When you sign up to be a physician, you're signing up for a lifetime of being on call. Like, even when you're not on call, you're still on call. And being on call means you have to be within the vicinity of the hospital and you have to be able to answer your phone and address an emergency when called upon. Now, having a life like this really puts you on edge, but I think you kind of get used to it. Like right now, I'm constantly checking my notifications while I'm recording this video just because I want to be available, even though technically I'm not on call. Now, there is such thing as a call schedule where there is one designated doctor that will take care of the patients that will come to the hospital. But the thing is, if you have a patient that you've been taking care of for several years and they get admitted to the hospital, you will still probably get a phone call to let you know that this person is here, even if you're on vacation. Obviously, that's going to depend on who's taking care of the patient and what hospital you're at and all that stuff, but it's generally considered courtesy to let that physician know that, hey, your patient is back in the hospital. And if there's an emergency, the on-call person will usually address it. But that's what I mean by that, is that you're constantly on edge even when you're not on call, because your patients could still show up at any moment. You can still get phone calls. There's still things that can happen to your patients when you're not on call. Just because you're not on call does not mean that neurosurgery stops. So I would say one of the most challenging things about doing this job, especially as a fellow or as a resident, is that you're consistently on edge because you can get called in at any minute.